Welcome back to the 4th annual Rush Lupus Clinic and LSI patient education event. This event is for educational and informational purposes only and serves to benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not substitute or replace expert medical care. Before making changes to your medical care, consult your qualified healthcare professionals familiar with your medical condition and health status.
Just wanted to thank all of you for staying put. I hope you've enjoyed the talk thus far. So next is this panel of questions that we will try to answer for you from the Rush Lupus Clinic, which includes me, Dr. Sequeira, and Dr. Nika. Dr. Nika, I wanted to just—
I'm here, yes.
just wanted to introduce. She is an assistant professor, an integral part of our lupus clinic. She is involved not only in taking care of patients with lupus, but also active on the Lupus Society of Illinois website, reviewing papers, little write-ups there, and then also involved in clinical trials as well as research and community engagement. I wanted to also introduce Dr. Sequeira, who will join in pretty soon. Dr. Sequeira is a professor of medicine at Rush, and he was the chief of rheumatology at Cook County Hospital. He is also part of our Rush Lupus Clinic, providing patient care, education, as well as research. And then I am Meenakshi Jolly. I'm a professor also and involved in providing patient care, teaching, research, and community engagement. So I'm hoping that Mary will be back pretty soon. And we can start with the question and answers.
I wanted to thank Dr. Jolly for the nice introduction. She's a great mentor. She's a great doctor. She's put together the lupus clinic, and she's so helpful in the lupus community, not only in Chicago, but nationwide and worldwide.
Oh, thank you. Now, I wanted to also recognize here LaShawn Gurola, who is our lupus support group at Rush called Learn at Rush. She's our leader. She is an amazing resource for all of us. And I'm going to request her to remain available just in case some questions come that may require her expertise if she's still around. So as you can see, we try to engage all our trainees, all doctors in here with the community engagement for patients and their family members, whether at Rush or otherwise. Dr. Arora is a trainee, but very well accomplished. Yes, LaShawn is here. So LaShawn, thank you so much for staying here. It's for the purpose of our support group or any other social work that come up. It will be helpful to have you here.
Okay, so I believe that I was able to get Dr. Sequeira on. He looks like he's still muted. He should be able to unmute himself. Sorry about all of these technical difficulties. Did you, were you able to introduce?
Yes.
Okay, I'm unmuted, yeah.
Wonderful. I'm so glad that that all worked out. So were you able to introduce each other?
Yes, we were able to introduce each other, and we also talked about LaShawn, who is still available if there are any questions related to that. And I wonder if there are any skin-related questions. I see Dr. Adisa is also here, if she would be kind enough to answer any questions that come up on that. So I would really appreciate that. We are happy to take any questions.
If anyone wants to go ahead and chat over any questions to me, or an email over any other questions, I think we could probably I'm just getting some chats in. So Dr. Adisa, who's presented for us in the past, is on, and she chatted out that she'd be happy to answer questions too. I know she was a part of the Rush team previously. But I think we can also just talk about COVID. I know we kicked off this presentation with COVID, but we're going to have questions about it for a long time. Can I just ask, how has your interacting with your patients been different during this pandemic?
Dr. Nika, would you like to answer that?
Yeah, I mean, we can both try to answer that. I guess in the beginning, for all of us, was shocking, was confusing. So we were a lot more stringent in the beginning. The clinics were closed for outpatient follow-up visits. And so for a while, we're not seeing lupus patients in the clinic, but we stayed in very close contact with the patients through either telemedicine visits or telephone visits, making sure that all the questions were answered, the patients were continuing to take the medication, a lot of confusion about the hydroxychloroquine, a lot of concern about shortage in hydroxychloroquine. So although we are not physically seeing the patients, we're in very close contact with the patients. That lasted for a couple of months until, you know, the clinics opened up again, and then we went back to seeing patients in person in clinic. But as we said before, Raj has been excellent in putting together a very terrific job in trying to maintain all the standards of social distancing, you know, masking, all the precautions necessary to keep ourselves and patients safe. So as far as lupus and COVID, so there is not a lot of data about, you know, COVID being different in people with lupus or autoimmune conditions. I mean, I guess they're all coexisting comorbidities, and so that would make someone higher risk as compared to a person without any underlying medical conditions. But there is nothing in particular about lupus or autoimmune conditions that was a red flag or a high concern about COVID exposure. On the other hand, our patients are in immunosuppressive therapy, so as a doctor, that's a major concern. And so we try to make sure we communicate with patients if there is any concern about either exposure or being concerned about having the disease, to get in touch with us right away, to discontinue some of these medications, to make sure that, you know, when they're free of the COVID disease, we start back the medications right away. So it's been challenging time for both doctors and patients, but I think we've gone through this pretty smoothly, and I think the outcome has been really good. Dr. Jolly?
Yeah. So I think you covered pretty much everything. What I would just add is, initially, as Dr. Nika mentioned, telemedicine came into effect, and we were doing any routine sort of visits through telemedicine. The volume was down, and we were still seeing patients that needed to be seen, people who were very sick and needed care. We were still seeing them, but we were limiting using our medical judgment on who should be able to come and should be able to be seen, take the risk of how they're coming, transportation and everything. But over time, the volume in the clinic has gone back to our usual, volume. And now, new concerns over the last 2-3 weeks have come up. But we've been trying to do all kinds of things, flexibility, providing flexibility to patients for follow-up. Patients who have active disease or are very sick, we still continue to see them. People who want to come, hospital is safe to visit. So what we have seen is we are trying to also educate patients about flu shots, re-emphasizing safety precautions, safety practices for preventing COVID. We've been also doing a lot of educational initiatives, whether that is for TV, web, social media, newspaper, or such, participating in the community to educate people about COVID or hydroxychloroquine and such. What I'm also noticing is that some of our patients are feeling that stress right now. I mean, lupus patients anyways have stress, and it can cause some flare in their disease. But there has been, because of COVID, stress, some anxiety, some coping challenges. Some people have been laid off jobs or have to reconfigure how to do their work. So these have been stressful times. And of course, some people have also felt depression, and we are lucky that we have LaShawn here to help us. Within the last 1 month, I've heard about depression and anxiety and suicidal ideation and all that. We are very lucky that we have access to someone who can help us coordinate this care. We have to be mindful and provide that support to realize when they're not doing good emotionally also.
Yeah, the support groups that the Lupus Society of Illinois has are really tremendous, and they're volunteer driven. As LaShawn is another person, Mari Gonzalez is also on the call. It's the only other support group leader I know, but I believe both of them also have a virtual component, so which is new during COVID. I guess one of my questions would be, because we did talk about how some of the symptoms of a flare for lupus patients are also overlap with concerns about COVID. And you said that you're meeting your patients virtually. Can you maybe walk me through when a patient who may be just experiencing a flare should contact you because they think they might be experiencing COVID, or should they instead just go try and get themselves a test?
I guess that's
yeah. Go ahead, Dr. Sequeira. Would you like to answer that? Dr. Sequeira?
Yes, I can. I've unmuted myself. Yeah.
Yes.
I think that's a difficult question. I've told most of my patients to contact me anyway, and then I talk to them over the phone. And if I suspect they are, if they don't have a high fever and otherwise no shortness of breath, I tell them to quarantine themselves for 2 weeks, but keep in touch with me and go from there.
All
Okay.
right. So what I will add is, as soon as a patient is concerned whether they've been exposed to a patient with COVID and don't have symptoms yet, or if they are noticing symptoms, the first thing to do is to quarantine yourself, isolate yourself so that you are not passing it on unknowingly to other members in the household. And then the second thing is to go around arranging how to get a test for COVID. Now, there are several ways to do that. The patient can contact their primary care doctor. There are community resources and, a walk-in or drive-in sort of places that are available with and without insurance. So those, or they can call us and we can guide them in the process of how to set this up, the test. But till the results of the test come, they should quarantine themselves. And after that, based on how they are doing and what the results were, if we are also able to provide any kind of letter accommodations if the patient does test positive, and any accommodations that the patients need who are immunosuppressed or such, we can provide letters, people who are significantly immunosuppressed. So those are a couple of comments. Does that answer, Mary, what you were asking?
Yeah, it does. I think that it's such new territory. And early on, we also had some questions, just as you were suggesting, about writing letters, or because their work was, they were social distancing at work, but the patient didn't feel as if it was enough given their immune situation. So do you write letters for anyone who asks, or do you take into account what their levels are?
Yeah, so I'll answer that. We take into account patients' lupus because so thus far the data suggests that lupus patients are not at a greater risk than anybody else that does not have lupus. But depending on how immunosuppressed they are, how active their disease is, what their job is, what does it entail, so we try to take those into account. For example, a patient who does not have active disease and is only on Plaquenil or hydroxychloroquine, we're not writing that letter, but it also is dependent on what kind of other diseases they have. If there are other diseases that put them at a higher risk to catch COVID, that may be an option, but these are different factors we take into account.
Yes, I would second Dr. Jolly. Having lupus or being treated for lupus is not a default for like needing like disability or any special circumstances for COVID purposes. So it's case by case, it's individual decision. It doesn't mean that we're going to be able to justify or give letters to everybody because they might not need. If lupus is stable, is under good control, we would encourage, to, use common sense and act like anybody else regarding COVID.
Okay.
If I may add to that, I think sometimes it's a bit of a conflict because the patients, particularly teachers, in my practice, most of them are teachers who don't want to go in because they're afraid of contacting the virus because they think they're being exposed. And even though I inform them that, their risk is no higher than that of the general population, they insist me writing a letter for them. And sometimes I relent and do that.
Okay. So you also said that you're doing, you're seeing patients virtually, but obviously you can't do virtual blood draws or things like that. So is that on hold during COVID, or are you directing people somewhere?
I'm going to let Dr. Nika answer that.
So even if we cannot see the patient in person during a doctor's visit, even if we can do that over the phone or as telemedicine, we encourage patients to go to the closest lab or to come to a rush because lab has been open and functioning all along. We have not been, it's kind of essential. So blood work is very important to measure disease activity. A lot of patients are on medications that are high risk, so need to check blood levels periodically. So we encourage that coming in for blood work, it's pretty safe, lab is open, and so would like patients to have blood work in regular basis, yes.
Okay, so that's still high priority.
Yes,
okay.
Absolutely.
What I can add to that is that if blood work is required, if it is indicated and required after telemed visit, we can put the orders in. Patients can do Quest labs anywhere close to them, which are absolutely open. And then within Rush, like in our institute, there are by appointment, there are timed slots that are open. So it is to reduce the traffic and exposure. So you make an appointment for your blood draw. In rheumatology clinic, our flow is limited, so we do blood draws right here. What we are also suggesting to patients is that if you do go for blood test, maybe try to go first thing in the morning when there's not as much traffic. So try to time it based on how much traffic there is and follow all the guidelines.
Okay,
safe
sure.
procedures.
We did get a question. We kind of talked about it a little bit earlier, but I'll ask it again. A person with lupus to take the vaccine as soon as it comes out, or will there be more studies? Should they wait for more studies to be done on lupus and the vaccine before they take it?
Dr. Sequeira, would you like to answer that? Dr. Sequeira? Did we lose him?
No, I think he's muted. Let's see if I can unmute him. I don't think I can.
Okay. All right.
I can't hear very well.
There we
Yeah.
go.
Yeah. Would you like to answer that question, Dr. Sequeira?
I didn't hear it very well. I'm
Oh, my
having problems with my.
Okay.
Go ahead.
A
So the
person.
question is it safe for a lupus patient to take the vaccine right away, or should they wait until there's more research on how the vaccine affects lupus patients?
I think they should take it right away. Theoretically, I don't see any reason for them to have an adverse event, no more than that of the general population. So I would take it myself, and I would recommend that all my lupus patients get it. After having said that, there are a few patients who have expressed their concern about getting the vaccination right away.
Okay.
Mary, also, I'm sorry, Dr.
No,
Jolly.
Go ahead.
No, I was going to say, I don't anticipate at any time to be any particular research about a specific disease and the vaccine. So I don't think it's going to be more research about lupus patients and the vaccine, or the vaccine is deemed to be very safe and the mechanism of action is pretty safe. So we don't think that's going to affect lupus patients in a different way that would affect the general population. And so, yes, I would recommend that to all the patients.
I pretty much echo what they're saying. Now, keep in mind, as Dr. Hassan said, theoretically, it does not make it is less likely, not as likely to get any side effects more than what she already discussed that you can get with any of the vaccinations. But keep in mind that for any vaccine, there are people who will have concerns and choose not to vaccinate. So it will be that scenario with some of our lupus patients too. Over time, the first wave probably will only include the frontline workers, healthcare providers, and other frontline workers. By the time possibly it gets opened to the public, maybe we would have a little bit more data also. But I would absolutely suggest, based on the risk involved, that yes, they can go ahead and get it.
Okay, great. There's also a question about, is there any truth to lupus going into remission after menopause?
So this is a good question. This is a very good question. So we think hormones, women's hormones, estrogens, have something to do with lupus because we see it in women. We see it in, women who are in this pregnancy age group, in the reproductive age group. So those things make us feel that women's hormones have something to do with onset of lupus. So if you were also, we know that when women with lupus get pregnant, their lupus sometimes, not lupus, their rheumatoid arthritis sometimes settles down. Lupus sometimes can flare, of course. But in menopause, those estrogen levels would be lower, and one can think that, yes, it can go into remission or become less active. Certainly, there is some truth to that.
Okay. Anyone else have anything to add? I think that was the last question that we had. We're almost out of time. I don't know if we haven't touched on anything that you think is relevant around COVID or anything.
No, I would just add here that this is, I know for a lot of reasons, this year has been not such an exciting, I shouldn't say exciting, such a positive year, but for lupus world in terms of treatment, this has been a positive year because we have newer medicines that are showing promise and waiting at the FDA for approval. So from lupus and new treatments, this is has been a good year.
Wonderful. Dr. Nika, Dr. Sequeira?
Yeah, I agree. Dr. Jolly was right. This has been a very good year about new medications, new positive studies in lupus. And also, I would say that this year has increased awareness about the health in general. So we've seen that people have been more attentive to their health, and I see that as a positive thing altogether. And I would like to thank everybody for participating in this great event, all the speakers, and all of you guys for putting it together. It was great.
Wonderful. Dr. Sequeira, have any closing
Yeah,
words?
I was going to say that this year has been very good. I mean, it's bad because we had the COVID, but on the other hand, we were made aware that our lupus patients are no more susceptible to getting the infection than that of the general population. And I think that was, for me, that was a very good thing.
Yes. Yes, it was, the amount of information that people didn't know in January, and then the learning curve has just been so amazing. And I think the most amazing thing about the medical community is how you've learned from each other, and how, like, if you have COVID today, your chances of surviving it are so much better. Even with all the question marks, the learning curve has been so great. So that's really amazing. As a member of the general public who doesn't know anything about medicine, it's impressive to see that, But thank you so much for your time, your energy, and for putting this together. Dr. Nika especially did an amazing job. Thank you so much. And I do want to hand it over to Charles. Charles, you should be able to, oh, there he is. You should be able to share your camera, and you can unmute yourself as well. There you go. There he is. Hi, Charles.
All right. Hello. Hi, Mary. With Dr. Jolly and all of the Rush team and the medical presenters today, just want to extend my sincere thanks for today's wonderful information that you provided our lupus community. This is, I think, our 4th year and joining you in this type of presentation, and every year it gets better and better, and we have more and more attendees. So thank you very much. And Mary, thank you for taking on the challenging task of pulling this all together. And I know that from time to time there are technology glitches, but you always are able to figure them out, so it works out fine. I only wanted to just take a minute to say to all of those that are here, thank you for being here. In addition to all the hard work that goes into preparing something like this, one of the important factors is that we have people attend. And we've had a large attendance here this afternoon, and we thank you for taking your time to participate in this seminar and listening to what was being said. This has been a challenging year for the Lupus Society, as it has been for everyone else. We have not been excluded from the challenges that everyone is experiencing. Yet we did not let this difficult period keep us from focusing on serving our lupus community. I'll just give you a quick example of some of the things that we did. We began 2020 with an educational event empowering lupus patients. We followed that, and that was in February, and we followed that in April with some webinars conducted by Dr. Jolly and Dr. Katz and Dr. Ramsey Goldman. And all of those webinars were focused on COVID-19. So we were very early in talking about COVID-19, answering questions. Obviously, it was all very, very new. We also had 3 webinars put on by GSK, our sponsor, Us and Lupus, and those were very well received. And we also did a seminar on Social Security disability, and also obviously today's event. As was pointed out, we have support groups. We have 2 support group leaders here today, LaShawn and Mari. And we thank you for being here. And we hope many of you had a chance to participate in our virtual walk. That's the first time we put on a virtual walk, but it was clear that we could not conduct the normal walks that we have put on in the past because of COVID-19 and our inability to gather large groups. But by not putting on the walks, we certainly were impacted. So while everything that we do and offer, we offer without charge to all of our lupus community, there is a charge. So I just ask you, as you are going about the rest of the year, to think about LSI. And normally in things that we send out, we have a little donate sign, but this year more than ever, that donate sign is helpful, important to us, because we could use any financial support that you would like to provide. So I'll end with that and turn it back over to Mary.
Thank you everyone so much for such a wonderful presentation.